Welcome to all. The last few weeks have seen a steep rise in dengue fever among residents of Bangalore. As such, it is important that we as a community understand this dreaded fever. Today, we will begin a discussion on dengue fever and focus on how and why dengue fever occurs. What causes it? What are its most important symptoms? How it is treated? We will also discuss the means of preventing this infection. So let's dive in. How does dengue fever occur? Dengue fever is caused by the dengue virus, which is transmitted through the bite of an infected Aedes mosquito. These mosquitoes thrive in tropical and subtropical regions, making them prevalent in many parts of the world. Female Aedes mosquitoes are the primary carriers of the dengue virus. They become infected when they bite a person who is already infected with the virus. Once a person is bitten by an infected mosquito, the dengue virus enters their bloodstream and starts replicating. The incubation period for dengue is usually around 4 to 10 days. During this time, the virus multiplies within the body and the symptoms may begin to appear. How is dengue fever diagnosed? Detecting dengue early is vital for timely treatment. If you experience symptoms such as high fever, severe headache, pain behind the eyes, joint and muscle pain, or rash, it's important to visit your doctor or a nearby hospital. They will assess your symptoms, conduct a physical examination, and order specific tests to confirm dengue infection. The most common diagnostic test for dengue is a blood test that checks for the presence of dengue antigens or antibodies or other viral particles. This test helps determine if you have dengue and the specific type of dengue virus. Early diagnosis allows for appropriate medical care and reduces the risk of complications. Is there a cure for dengue? Currently, there is no specific medication to cure dengue. Treatment focuses on managing symptoms and providing supportive care. It includes plenty of rest, drinking fluids to stay hydrated, and taking medications to alleviate pain and fever. However, it's crucial to consult a healthcare professional before taking any medications. Why do some patients with dengue fever become very sick? While most dengue cases resolve with proper care, in some instances complications can arise. Severe dengue, also known as dengue hemorrhagic fever, can lead to plasma leakage. By that I mean the blood becomes thick, resulting in breathlessness, abdominal pain, and intense weakness. It can also result in kidney and liver failure and abdominal bleeding within the gut, skin, or other important organs. Sometimes it can even cause death. It's essential to be aware of warning signs such as severe abdominal pain, persistent vomiting, bleeding gums, or difficulty breathing. Most patients with dengue will develop a drop in blood counts, including white cell count and a platelet count. Though the exact mechanism of why this occurs is unclear, these counts eventually increase on their own once the virus is subdued. That's it for part 1 of this video. In the next part, we will focus on prevention of dengue and if there's anything that you can do to avoid developing this infection. Thank you very much for joining us on this educational video today and stay tuned for our next one.